Good afternoon and welcome to the COVID-19 public briefing for Thursday, April 16th. I'm Brian Beam, Calcasieu Parish Administrator. We're going to have a few speakers today, some that come every time, a couple of new things today as well. Let's lead off with Emergency Preparedness Director Dick Grimion.
Thank you, Brian. As usual, I'll start out with our testing results for this week. We just completed the three-day testing this week, the 9 to 12 o'clock. We had 53 cars come through and we tested 49 people. So the numbers are off by about 20% from last week, which they're going down, which may be a good thing. So they'll evaluate. We're going to do it again next week, and they'll evaluate at the end of that week whether they can discontinue at that time. Our usual preparedness tips: please wash your hands a lot. The CDC now is advising if you go out, it might be a good idea to wear a mask. That's optional, but washing the hands is the most important part. Sneezing into your elbow, and of course social distancing, which we are practicing here at the EOC today. And I'll save the questions for me till the end. Thank you. Yeah, just to be clear, the testing site at Burton Coliseum is what we're talking about. Next week, at the end of the week, they'll evaluate whether we can close that site as a testing site. As I just mentioned, the numbers have been going down, so that may be a good sign.
Okay, thank you, Dick. And next is Dr. Lacey Cavanaugh, Director of the Office of Public Health.
Hey, good afternoon, everybody. Just a couple of comments to follow up what Dick said about the testing site. If there ever becomes a point in the community that the numbers at that site drop, that does not mean that this response or this pandemic is over. It just means that efforts are switched to a different part of the battle. I want everybody to understand that COVID is going to be around and is going to be in our community for a long time to come. And so over time, our strategy may change. That may be, the numbers may be dropping for lots of different reasons. One is that hopefully it means that we have less disease spreading around the community and less people who need testing. But it also means that other testing sites, because there are many other testing sites within hospitals, within private clinics out in the community, as testing ramps up at those sites, then sometimes there's less of a need for a giant site because that healthcare has then transitioned into another phase of the response. So just wanted to clarify that does not mean, the fact that those numbers are going down does not mean that this response is over within our community. The good news in terms of number of positives that we're getting across the community, those numbers seem to be, they're still increasing, but they're increasing by less numbers each day, less percentage of people who are positive and so that's good. As a state, we've done over 126,000 tests since the beginning of this outbreak, which is really an incredible feat. So testing capability does continue to ramp up. We're also not just looking at testing capability to know what's happening within the community, because we also know that as testing becomes more available and we test more people, we find more cases. So we are also looking at rates of hospitalization, rates of ventilator use, and rates of death to determine what the true burden of disease within the community is. We have 1,900 or so people within our hospitals in Louisiana, and 396 of those on ventilators as of today. And you'll notice that those numbers have also trended down over the past few days and past week. But one thing you will notice is that our deaths have not really substantially gone down. Remember that it may be up to 11, 12 days after someone starts to show symptoms of COVID before they actually die of COVID. So because of that, death is going to be a lagging indicator, meaning that'll be one of the last numbers that we really see start to trend downward. But But overall, definitely it seems like we are having some success with our social distancing measures and with flattening of the curve, but that doesn't mean that it's over. We've kind of stopped the tidal wave that's coming at us, but now we're going to have to figure out what comes next. And I think that that's a very difficult question to answer right now. For regional statistics, I'll kind of go down by parish. So in Calcasieu, we have right at 300 cases of COVID currently, with 15 deaths and about 5,000 tests that have been run. Beauregard has 33 cases with 2 deaths. Allen, 78 and 9 deaths. Jeff Davis, 48 cases and 5 deaths. And Cameron Parish has 2 cases that we are aware of. Now, we do know that there is a little bit of difficulty with that data in particular, because there are some zip codes that cross parish lines and make it difficult on the electronic reporting end to make sure those are classified correctly. We are aware of that, and we are working to hopefully fix that issue at some point in the future. One thing I'd also like to say is that you may have heard chatter about this number called the R naught, which is the number of people that one person who has COVID, then how many more people do they infect? And the R naught of COVID, when we first started this outbreak response, was at about 2.4, 2.5, which means for every one person who had COVID, that at least 2 to 2.5 more people were infected per case. With social distancing and modeling, we think that we've brought that number down pretty substantially, a little below 1.3. Of course, those numbers could change at any minute if we stop doing the things that we're doing now. But what that means is that social distancing has been effective at slowing the rate of transmission of this disease within our community. We still, at this point in time, have hospital capacity and ventilator capacity in Southwest Louisiana that is sufficient to meet the projected need in the near future. But, there's a lot of uncertainty about what these numbers may look like next week, because we do know that over the Easter holiday, many people who were doing a really good job at social distancing may have relaxed a little bit. And we've gotten reports just from people on the ground that over Easter people did gather. And if that's the case, we would not expect to see the numbers rise from that until sometime next week. So we're definitely paying very close attention to all of those numbers of how many people are tested, how many people are positive, how many hospitalizations, and how many deaths we have within the community as we watch this unfold. So social distancing is just as critical as ever. And I know people are tired of hearing that, but we are not out of the woods yet. It does work. It is saving lives. And all of you in our community who are adhering to those guidelines and actually doing it are really heroes, because it's saving other people's lives. You may hear a little bit of change of language. Instead of calling it social distancing, you may hear people now referring to it as physical distancing, because really it's not about reducing social contacts. It's about staying 6 feet or more apart from other people. And so we can still potentially speak with other people or interact via other ways. So you don't have to cut out all social contacts. You can talk on the phone or from a safe distance and still connect with people. So you may hear that social distancing language start to change over to physical distancing instead. We do know that there are definitely disparities, like we talked a little bit about last week, between different communities. And our African American community has been hit particularly hard across Louisiana, but also here locally in terms of the rate of death in that community from COVID. So there are a lot of reasons for that. But definitely it's a challenging time, and we need to make sure that we focus efforts where they're needed the most. And I definitely think we're working on plans to try to address that going forward. Testing, of course, the testing situation continues to improve. The ultimate goal of testing is to eventually be able to do a lot more widespread testing and basically test everybody. The quicker we can get results, the more people we could test, the better disease control we're going to have in the long run. It's just been such a challenge in getting all of the supplies that we need here locally and across the state and really across the whole country has been struggling with supply chain challenges this entire time. And although the situation is improving, we're still a long way from an ideal state where we could immediately test, have rapid turnaround results, and test everyone who not only is positive, but who is a close contact of a positive. That would kind of be in an ideal situation, and we're definitely working there. The PCR testing that we've been considering first line that you've been hearing a lot about is definitely still the primary thing that's available within communities, but we do have to realize that it doesn't catch 100% of cases of COVID. So people who have classic symptoms, even if that PCR test is negative, it's still possible that it's COVID. And so sometimes we still will recommend for anybody who's sick to isolate, even if they got a negative test, especially if they have classic symptoms. You may be hearing also about antibody testing. So this type of testing is not widely available yet within our communities, but we do hope that one day it will be. It will hopefully be able to detect someone's immune system response to the virus and eventually give us a picture of who within our communities are immune to this disease and who isn't. And we don't really know how long people are going to be immune. Once you contact the virus and you recover from the virus, are you immune forever or just for a few months or maybe a few years? And we don't know the answer to that question yet. But at some point, we hope that will give us more information as we learn and study more about this disease. No major changes this week in terms of treatment recommendations or vaccines. We're still a year out plus from any vaccines being ready for public consumption, and definitely continuing to gather information about potential drug treatments. Some of the ones that were extremely promising early on are now kind of being called into question. Are they safe? And we kind of expected that to happen because when you do a study on 20 people, it doesn't give you results that are then widely applicable to the entire population. It takes time for good scientific studies to be done. So I expect that over the next coming months or even years, we will hear about a whole lot of really promising things that may or may not eventually pan out. But definitely continuing to do the good work of doing that research is critically important for us to be able to fight this. And like I said, the hardest question right now is what is the path forward? And unfortunately, I don't have a good answer for you. It is filled with a lot of uncertainty. I know that it won't look exactly the way that it was before all of this started. And what normal looks like from this point forward may not be the same everywhere. But I will say that I'm confident that in this community, we are all in it together. And I have confidence that we're going to figure it out. And that's all I have.
Thank you, Dr. Kavanaugh.
We'll go ahead and pause and see if there are any questions related to her comments. And can you please use the microphone?
Dr. Kavanaugh, when you say eventually you hope to have everyone tested, do you mean for the infection or for antibodies or for both?
I would imagine that at some point we're going to be deploying strategies to figure out what percentage of the population is actually immune. I don't know if that means that every single person would receive a test, but some sampling of the population that then we can use to make calculations. And then I also think that everybody who is symptomatic or is a close contact of someone who has known disease at some point, it would be ideal to be able to test to those people. So basically what I mean is at some point, I hope that we have robust systems to identify and track and all of the cases of COVID in the community and their close contacts to try to stop it from progressing within the community.
Seem to be getting conflicting information about the availability of personal protective equipment. To what extent do our medical people have what they need and have enough for the future?
Certainly don't think that the PPE situation is perfect yet, but I will say that it has improved substantially from a week or 2 weeks ago. I don't know of any critical will run out tomorrow needs. In speaking with a lot of our hospitals, they don't have an ample supply that's going to last forever, but their immediate needs seem to be met. We actually received some shipment of PPE from the state level over the last couple of days, and we've been spending a lot of time here at the regional office making sure that that gets distributed out to the people in the community who had put requests in. It didn't meet all of the need, and we know that there are still some people who are waiting on supplies and equipment. But I will say that the situation is improving, and it seems to be easier to get now than it was a week or 2 weeks ago.
I was wondering if some of those who get COVID will wind up with lingering health effects. In other words, some of the younger people may figure, well, if I get it, I'll probably survive. And I just wondered if, for example, they may wind up with emphysema or something like that.
Well, I don't know of any specific link to, say, emphysema. But I do know that there's a lot about this virus that we don't know, and we're learning more every day. I have seen some small studies that show potential ongoing long-term implications of getting the virus, but how widespread those are and what those really mean for our future health, we don't really know yet. So that's part of the uncertainty about this virus that we're still learning a lot about. So I don't think it's out of the question that it could have longstanding health effects, but none of those have been proven at this point either. So we're in the gray zone there.
Okay. I was wondering, we're getting complaints and concerns from relatives of people in nursing homes, and these relatives are saying that now that they can't visit them, that there are a bunch of problems, and even with their daily diet, that they're not getting adequate nutrition. And I was wondering, under these circumstances, what is the state doing to inspect these nursing homes?
So part of that falls a little bit out of our wheelhouse because I work with the Office of Public Health. And so we are not the regulatory sort of arm of for nursing homes. So we have been reaching out in a case tracking and sort of supportive and guidance way. There are regulatory arms within the Department of Health that do take complaints and respond to complaints. And the process for those complaints to be filed has not really changed in light of COVID. I do know that our health standards section that typically responds to those sorts of concerns is still operating and still doing what they can to make sure that nursing homes follow guidance and is safe. So the process for that hasn't changed, but unfortunately, it's not something that I work with personally every single day. So I definitely can direct folks to the right place if needed.
Okay, and also, we have the restaurants obviously distributing food, and sometimes there are like nonprofit groups and that sort of thing. What, if any, special guidance has the health department given these various groups who are handing out food in order to not potentially spread COVID?
Right, so we do have under our wing in the Office of Public Health, we do have a sanitarian program that is responsible for reaching out to places with food service and making sure that our food is safe to eat. And although their workflow has changed some, obviously in light of COVID, they are still working with restaurants and with places that serve food to ensure that food is safe. So that continues to happen even in light of COVID.
What if it's like a civic group or something that decides, okay, we love our doctors and nurses, we're going to barbecue chicken dinners for all of them on any given day?
I'm sorry, I had trouble hearing that one. Can someone repeat that question for me?
Try it again, Teresa.
Okay, suppose the people bringing the food are a civic club or something. They're not a professional restaurant that has a license and they just want to do something nice for the people in general or our medical personnel or something like that, and so they, barbecue 100 dinners and want to hand them out. Is there any guidance that these people have been given or that they can get in order to make sure they're not spreading COVID?
So I definitely think that they're the same guidance that we would give for prevention of any infectious disease when it comes to food preparation. And so the most important thing to do is to make sure that you wash your hands and that food is prepared according to making sure that the temperatures are correct and that sort of thing. So I don't know that there's all that many special COVID precautions. Although I know there is a lot of guidance on the CDC website about preparation for COVID and how to respond to COVID in a variety of different industries. So if people have very specific questions about food safety, then I would direct you first to the CDC website, and second, if that question can't be answered, then send it to me.
Thank you.
Any other questions, Teresa? For now, we can come back later. At this point, we want to stay on the medical issues, but a little bit different track. There has been information, a little bit more lately, some of it misinformation, that deals with whether some of these deaths attributed to the coronavirus or coronavirus related are really truly coronavirus. To try to address that issue, we have invited Dr. Terry Welke, who is the Calcasieu Parish Coroner. He is remoted in. We're going to ask him to make a few general comments on this and then take any questions after he speaks. Go ahead, Dr. Welke.
Thank you. I appreciate it. I've heard these concerns, and when what happens is when we receive information from either some investigating agencies, such as the Sheriff's Department or the Police Department or a hospital, then the investigators will take that information and relay that to me. I will filter out that and determine what the precipitating event is to determine the cause of death. And presently, we have 16 deaths due to COVID as of today. And unfortunately, there are about that many in the parish that are on ventilators. So I'm sure that number will continue to rise. But only the deaths that are directly related to coronavirus will be placed on the death certificate. For instance, if someone were to die as a result of a gunshot wound or being struck by a vehicle or something of that sort, obviously the cause of death would be due to those, as opposed to, even if they had coronavirus as a secondary infection, or it was found coincidentally, that would not even be listed on the death certificate. I do not know what the state or the rest of the nation is doing. I know that CDC at one time wanted, even if someone were a gunshot wound, but they had coronavirus, they wanted that placed on the death certificate. And unfortunately, that skews the numbers and gives an invalid total. And recently, I think New York City, the state of New York, had increased theirs by over 3,000 because they'd taken some of these people that were having problems, such as the shortness of breath and a high fever, but even had not been tested and felt that they were coronavirus. And so that was included as well. And I understand that a lot of people think that this is possibly inflated to go ahead, and I don't know whether it's a scare tactic or not, or is what they may be thinking, but it is not. This virus is highly contagious, and a lot of people still think that are not taking it seriously. A short while ago, I drove past Prairie Park, the Prairie Lake Park, and there were a lot of people there, and none were wearing masks, and some people, in fact, there were a fair amount of people sitting at picnic tables close by in groups, and I think that's a great concern. I don't know whether when Easter had hit, they thought that since it's passed, everything's pretty much subsiding, which is totally not true. I personally would like to see people wearing some sort of a facial cover if they're going to go around and be around other individuals, because I know the 6 feet thing works. A lot of these people are just not taking it seriously. I'd like to see these numbers as far as the deaths decrease, and as well the numbers of the people that are getting them. So, again, like I said, when I fill out the death certificate, I do not put anything on there related to coronavirus unless that actually is. And like I said, today we have 16 deaths. So, and that's all I've got to say at this time.
Thank you, Dr. Welke. Are there any questions on this issue? Yes.
Well, I mean, is there a way to distinguish, say, excuse me, say someone, is struggling with heart failure and they die and they also have COVID? What is the way that you distinguish whether they died of heart failure or COVID, or is that even possible?
Well, I appreciate that. With the heart failure, the coronavirus, it's such a new disease. We really don't know all the problems that go along with it. And people can have, the way that I determine this is if you have heart disease, which the 16 people that have died thus far have had heart disease. So that's the common denominator. So what happens is if they start to have problems as far as the shortness of breath and the spiking of the fever, as well as being placed on a ventilator, then that's taken into consideration. Most likely the cause of death is going to be due to the coronavirus. And then like I said, that a pre-existing condition, which unfortunately is some of the problems of the people that have died.
I was wondering if you have any role or have been consulted with regard to the situation up at the federal prison in Oakdale, and whether you have done an autopsy on any of the 7 people who have died, all of whom did die in the hospital.
They asked us to do that. Unfortunately, our facility is ill-equipped to provide an autopsy service and be able to protect us, the staff and myself. However, they were in need of taking the bodies, and so we did store 3 of the bodies here about a week and a half or 2 weeks ago. But no, like I said, they did ask us to do autopsies, but we refused to do that because they already had positive the test was already positive, and felt that an autopsy was not necessary.
Okay, and there was some type of story today, and I'm sorry, I don't know if it was national or state, but something about someone catching COVID from a dead body. Do you know anything about that, or can that happen?
I don't. However, I've been following the people that do the forensic stuff, and there are not a lot of people that are doing autopsies, mainly because it has not been going on that long, and there's a lot of unknown factors. However, I did see where someone had done autopsies on 2 individuals who were on ships that were kept in coolers, and when they got to land, they did an autopsy, and they found out that they had done testing, and the testing of lung tissue was 14 days, was still positive 14 days after the person had died. So, like I said, unfortunately, we don't know what the particulars are going to happen, and as Dr. Kavanaugh stated, another frightening thing is these young individuals think that they're not going to have any problems, but on down the line, we have no idea what the lung conditions are going to be over the long haul. So I think a lot of people, like I said, are not taking this seriously enough, and they need to go ahead and do that social distancing better.
Well, and one more, as I recall, you have a role as far as providing medical care to the inmates at the Calcasieu Jail, and I was just wondering if you know anything about whether there's any COVID there, or whether there has been any testing of inmates, and if so, what the results are.
No, I don't do that any longer. Sheriff Glenn Houston will probably answer that for you in a little while.
Okay.
Yeah, and he will be coming up shortly on it. Thank you, Dr. Welke. That was very helpful.
Sure.
In case, I hope I don't get the numbers wrong. If you heard earlier that the number of deaths reported in Calcasieu was 15 still, you heard Dr. Welke say 16. It's important to understand that the official reporting for that is on a time basis, so that may that may be understandable if there's a slight difference, but at the latest, it'll be recorded the following day, so that will be corrected, or updated, I should say. Okay, we're going to move on now to a couple of members of the, Executive Policy Group. Police Street President Tony Gilry is our next speaker.
Thank you, Brian. We know that we are still in a hard place. We also know that what we are doing is working. We have to be patient for you and for all our community. I will do my part and hope you will do your part too. We will get through this. And as always, I'm asking, please stay home, stay safe, and save lives. Please. Thank you, Brian.
Okay, we do have, Mayor Hunter is participating remotely, but I believe, Nick, unless you've changed your mind, he was just going to take any questions if there were any specific to the city of Lake Charles, or if you think it might be, we can certainly ask that.
Thank you, Brian. I am here to answer any questions. There's really no major update from the city of Lake Charles. And so, again, I'm here to participate, answer any questions if they come our way.
Okay.
Nick, I don't know if you would want to
about
say
this
anything
or
about
not, but the governor, talked about the fact that hurricane season is coming soon, and I know you work with OEP and all, but we're going to have more shelters if we have a hurricane because the people will have to social distance, and so I don't know if you have any thoughts on that, as well as if you watch the governor's conference, you know that he appointed Ronnie Johns to this new task force that's going to help figure out, where to go from here. So if you have any thoughts on either of those, I'd be interested.
Mayor Hunter, if it's okay, I want to take her first question. You can add to it on the sheltering. There is a sheltering plan in place that was completed last June. It's called the Calcasieu Parish All Hazards Plan Sheltering. It's actually coordinated through our parish, through Angela Jewett, who's over what we call the Medical Reserve Corps. But she works very closely with other parish staff, City of Lake Charles staff, and actually others who were involved in that. So that came about primarily after Hurricane Harvey. So it's a very detailed plan, and like any good plan, it is set to be utilized but modified as needed to the particular incident. Therefore, to try to address your question, I think it's kind of a what if. So hurricane, let's say it's early hurricane season and you get an early threat of one, and we might need sheltering, but you still have the, physical distancing issue is what I hear Dr. Kavanaugh referring to it as. We would make sure that that is accounted for in any sheltering. I think you would have to have this, but you'd have to physically separate them better. I don't want to get too much into the what ifs, but I would say you have the benefit of sheltering, which can save lives, is paramount, and you might have to take a little more risk with distancing, but you could still adjust for that. So I believe that's accounted for and easily planned. Now that we know, the one good thing about hurricanes is you have a season, so you know when it's coming. And they've already started discussing that because that's June 1st, right around the corner. So it's a good question. It's already plans in place, but we'll have to adjust that based on this new threat or potential threat. And Nick, of course, if you want to add to that from the city standpoint, go right ahead.
Thanks, Brian. And Teresa, we have had a lot of proactive conversations with the police jury and OEP. We have a lot of faith in OEP and the proactive steps that have been taken. I can tell you that question that you asked has been discussed over the last few weeks and days. And so very confident that we've taken some good proactive steps. I'm very excited that Ronnie Johns was appointed to the governor's commission. I think that's going to be a wonderful thing for Southwest Louisiana. And Senator Johns has a wealth of knowledge about the economic needs of Southwest Louisiana, and that is going to be key because the immediate concern, as always, has been the health and the safety of our But eventually, as our community and economy does start to open up again, it is not going to be just like flipping a switch. These effects are severe on our economy, and I'm very excited that Ronnie Johns, a small business owner, someone that's been here many years, is going to be on that committee to make sure that our voice is heard in Baton Rouge from here in Southwest Louisiana.
I'll add to Mayor Hunter's comments. I too, in the parish, Tony and all of his colleagues, feel very good about this. It shows a lot of visioning on behalf of the governor and the state to try to get help as to what do we need to do. And I can't think of anybody better to represent us locally than Ronnie Johns in that effort. If you think about what the state's budget currently is impacted by, and this of course is for all private businesses as well, but just the state's budget alone gets revenue from income taxes, corporate and individual, sales taxes, gaming revenues, even severance taxes. All of those have been affected negatively by not just this virus, but oil prices and other things. And of course that affects all of the industries that the state relies on. So there's no one person or small group that has all the answers, but we need a group to be thinking ahead more than just for the present. So I agree with Mayor Hunter 100%. Think it's a great idea. And to the degree they need us locally, we are there and ready to help out. We just have a couple more speakers before we wrap it up and any general questions. I want to ask Sheriff Mancuso, who is tied in remotely today, to make a few comments, and he may want to address the question that came up earlier, Teresa. But Tony, if you're ready, go right ahead.
Yeah, no, I don't have a whole lot to report either. I am pleased about Ronnie and the governor appointing him. I do think that's what separates us maybe from a lot of areas is, although I don't even want to mention the word hurricane right now, but we are prepared for that in the event something like that happens. I'm talking about as a parish, as a whole. You know, we have always been on the same page. When we get into a room and we discuss what we're going to do, and we come out of that room as one, and we make our decisions based on what's best for the public and what we think is the right thing to do. So
I am very pleased also with that. Crime-wise, again, things are pretty quiet still. We have had a little uptick in our call volume, but again, it's still lower than normal, so pleased with that. I think, and I've heard it from the two doctors, and I appreciate everything both of them do for our community. And I can tell you, this is not the time to let our guard down. And I think that's what happens as we go through this and things look better, and they are looking better. I think they look promising. But I think if we relax now, then we're just going to get punched right back in the nose in a week or two, and we don't need that. If everybody will take a deep breath and realize, have a little bit longer to endure this. I think we're all tired of it. You can see it in your co-workers and your family members. I think everybody has just about had enough of this. But you know what? We're doing just fine. Life is not that bad. I think it's changed many of our ways of doing different things. But you know, it hadn't killed us, and we're gonna continue to get better, and we're gonna do better, and we're an amazing community. So I think we just need to take a deep breath and endure it for the last or the ending stages of it. If we give up right now and say everything's okay, I'm afraid that it's going to have a different consequence if we don't wait it out and do what, again, I'm not an expert at this and don't profess to be, but I know our doctors are all telling us the same thing. So I'm urging people to please listen to what the doctor is saying. Teresa, to answer your question about the jail, you know, I had a meeting with our wardens and told them, I don't know what they're doing, but I'm very happy and pleased. We have, you know, we have worked very hard from the beginning of this to monitor our jail population and what's going on in our jail population. by taking temperature. And listen, I'm not talking about, we monitor everybody, not just the inmate population, but us also. We take our own temperatures and we're monitoring ourselves as we go through the process. So we have not had any cases. And again, I'm knocking on wood. I hope you didn't jinx me by the question, but we've had people who have come into the jail that said they were around people with COVID. We separate them, we isolate them, we monitor them, we quarantine them, however you want to talk about it, for the 14 days. We have not done any tests because nobody has shown symptoms, so there was no need to, but we quarantine them, we isolate them. If they said they've been around somebody until the 14 days are up, and if they have not been released for whatever reason, they haven't bonded out, then we put them into population after that quarantine time. So we're taking all the steps and precautions, and again, I've looked. I get numbers from the Louisiana Sheriff's Association every day, and there are other jails that have not had any outbreaks. So we're fortunate, and I'm going to give credit to the men and women. You know, the parish. I think, Brian, we talked about this at one of our other. The parish, by law, is responsible for the health and welfare, or the health, the health care of our inmates. But we work very closely. The parish hired a nurse recently who works with our doctors, and they have really been on top of this. Jeff Clark is his name, and he has done an amazing job with our inmate population and our deputies. And I know Dr. Kaufman, he's been working with you pretty much on a daily basis about questions and our procedures and what we're doing. So, Teresa, I guess that answers your question, unless you have a follow-up with it. But no, we've been very fortunate. I give credit to Jeff and what he's been doing, and the deputies, the men and women that work there, and what they're doing to combat it, make sure it doesn't get in there.
Okay, that's all the questions. Thank you, Tony, and we appreciate all law enforcement. Just the presence is a calming effect. I think the approach has been great from the sheriff's office and the city's police departments in monitoring, but you're not going to hear stories like you might hear across the country where you've had some dust-ups where there are arrests and so forth, and I think that's because of the approach, and we appreciate that. We're going to switch.
We constantly communicate, Brian, also on a daily basis with our chiefs here in the area. Again, we're on the same page.
Thank you. Yes. We're going to switch now to community assistance, and we've heard so many good stories. You have public sectors reaching out to help folks for things like feeding and other needs, private companies, and many nonprofits, even school groups. And so it's very heartwarming in this treacherous time. It's a good opportunity for us to get an update from Denise Durrell, Executive Director of the United Way, regarding some of their latest efforts.
Thank you, Brian. I'm very happy to let everyone know of a new program that we just launched yesterday with a partnership of Entergy Louisiana and the Blue Cross Blue Shield Foundation and United Way. Thanks to the financial support of Entergy and Blue Cross, they have each allocated $50,000 for a total of $100,000 to be spent here in our community, thanking the people that are still out there working day in and day out, so that those of us who have the opportunity to be at home and stay out of harm's way. And the way that we're thanking them is by providing them with a meal while they are in the course of their workday. We kicked it off yesterday. We actually were able to feed the group out at Burton Coliseum. We fed the OEP office today. We had the pleasure of feeding the employees of the city of Lake Charles. We're also, in addition to, we're getting ready to feed the folks at Lake Charles Memorial. And so we're thinking about outside of the box about everybody who's working, not only those in the healthcare community, not only our governmental departments that we want to support, but also the grocery store clerks, the people, our local media, our bank tellers. So we're really reaching out, and our goal is actually to give out 100,000 meals over the course of the next few weeks. But the plus side to this is the meals are being purchased and prepared by our locally owned restaurants. So again, trying to put those businesses and to give them some economic boost as well as they provide these meals for us. So we have so far 11 participating restaurants. We're still looking for more that would like to participate with us, and they can call us for more information at our office at 433-1088 if they would like to. But we're really excited, and we want to thank Energy Louisiana and Blue Cross Blue Shield for trusting us with this program. And then just secondly, want to make the announcement that another wonderful partnership that we're really excited to announce with Second Harvest, Food Bank, and United Way of Southwest Louisiana. We are actually going to hold a food distribution event on Wednesday, April the 29th from 11 a.m. to 1 p.m. in the parking lot of the Preon Lake Mall. And we're actually going to be handing out 2,000 boxes of meals that people can, perishable and non-perishable items, that people can take back home to their own homes and prepare. And they actually should be able to prepare about 3 meals out of each box. So we're looking at, in 1 3-hour period, giving out over 6,000 meals. And so we're really excited about that. More information will come, but just if you want to mark your calendar for Wednesday, April the 29th, 11 to 1. And we do want to thank the Calcasieu Sheriff's Office. They are going to be help directing us and making sure that traffic flows pretty smoothly, because we are expecting a pretty large crowd that day. So, but we're very excited to announce that as well. So, thank you.
Thank you, Denise. Very good news. As you listen to all the speakers, there's a common theme that we've seen throughout this, and that is where we've already had relationships, they're building partnerships that are new and creative. Just in that last example Denise gave, you're talking about 2 or more public agencies, private agencies doing their part, and it's countless. And that, I want to second something Tony said a minute ago, our sheriff. That doesn't just come if your community isn't already well bonded and used to working together. You get new things out of it, but it's built on existing relationships, and that is very helpful, because a lot of people are in need, a lot of work, a lot of unemployment filings, and that helps a lot. That actually wraps up our list of speakers for today, so we are now shifting to any remaining questions on any of these topics or others that weren't covered. Yes.
I just wanted to ask about unemployment insurance or payments. We're still getting complaints from people who are not, not getting payments or whatever. And I don't know, is there a distinction if whether an employer categorizes someone as furloughed and fired?
I believe there is. I want to be a little careful at trying to decipher that. I know we probably have somebody who can answer it better. I just don't know who that is right now. There have been some furloughs. As I appreciate it, Teresa, and this is a general, I'm not going to say I'm perfect on this, where you have a furlough, it means that that person is not currently working and not being paid for the furlough period, but they are still employed, and they may continue to get some or all of the benefits that come with that particular employer. Could be public, could be private. So that's not the same as, say, a layoff. When you say fired, the word I think commonly used for any separation is called a termination, but that may mean somebody quits, there's a layoff due to lack of funds maybe, and then there's certainly somebody who may be fired for something against the company policy. But furlough is not the same as being fired, but it is it involves a length of time where you're not working and they aren't paying that person. Now each case is going to maybe be different, but that's a general description.
Well, I mean, so would it save an employer money if they say these employees were fired versus these employees were furloughed?
Well, the furlough, I think the idea there is you are hopeful that there is a point where they can be brought back because the funds are coming in. Give you an example. If you take a government entity, and this is anywhere in the country, but a government that's gets a majority of its funds from sales taxes. Well, in a city, for example, think of all the commercial businesses that are shut down who would normally be having sales tax generated. That's greatly reduced right now. So there may be a point, and I hope there is, I'm sure there will be, later in the year where things pick up, it may be in phases. If you furlough an employee, that means your intent is you want to bring them back when things are more manageable financially. That's not a positive action in the big picture, but it's a better action than saying we're closing or you're laid off. That's more permanent. So, but you can save a lot of money, obviously, in labor costs for a limited period. So it's a condition that's not a pleasant one, but it's a better one than saying this business is closed or this layoff is permanent. So that's a pretty important difference. There's hope with a furlough is what I'm saying, to bring them back.
Does it influence whether the person who no longer has a job collects unemployment?
That I don't know. I don't want to try to answer that. Is there anybody who knows that one? If we can get somebody who can answer that and text somebody, Dick Grimion. I don't even want to touch the rules for unemployment. I hate to say that. I'm not the right one to answer that.
Just throwing it out there.
I suspect, I believe there probably is, because it is an action by that employer. It is not an employee who just chose not to come in because for whatever reason that they're scared of the virus or something. But I'll stop there. Any other questions? All right, so I think in wrapping it up, the message we're hearing from our medical professionals who caught us up today, doing good at the social distancing or physical distancing is working, but it's important to keep doing that for the time being so we can keep these numbers down. A reminder, we are seeing a lesser ratio of people who are affected by others with coronavirus. That's a good thing. That means social distancing works. We got to keep it up though. And we've also, it's paid off in many ways, including jail populations, the general populations, and others. Also, I think once this commission that the governor appointed, that Ronnie Johns is on, begins to meet, we'll ask Senator Johns to come up and give a report directly from their discussions and meetings. I think that'll be helpful. And I don't know if it'll be as early as next week, but the next briefing to wrap this one up will be next Thursday, April the 23rd at 2 p.m. Thank you.